Rauscher, your host for this morning or this afternoon web seminar. We do still have a couple of people logging on, so I'm going to give it just another 30 seconds or so, and then we'll go ahead and get started. So welcome everybody to this afternoon's web seminar. This is Debbie Rauscher, the host for today. Got a couple of people still coming on, so just give it another minute or so. So we're going to go ahead and get started. This is Debbie Rauscher. For those of you who don't know me, I'm a consultant working with the City of Oakland. I am joined today on this web seminar by Susan Shelton, who I'm sure that you all know, the Director of Community Housing Services.
Hello.
Hi, Susan. Welcome.
Thank you.
So we're just starting right now. So we've got 26 people on the web seminar. So welcome to everybody who's joining us this afternoon. So, Susan, did you want to say anything, or should I go ahead and jump in?
You should go ahead and jump in. Folks, I'm putting myself on mute because I'm on the phone, but I have you on computer, and the feedback is kind of annoying. So I'm putting it on mute, but will unmute myself if I have anything to say, if you have any questions for me. Go ahead, Debbie. Thank you.
Great. So I wanted to start by actually going over some logistics. Some of you are listening on your computers, and some of you are listening on the telephone. So sometimes the sound coming through computers is not great. So if you are having any sound problems, you can use the telephone option. And if you're calling in by telephone, and Susan, for example, you mentioned some feedback, on the control panel where it says audio, you'll see that there's an option for telephone and then mic and speakers. So you want to make sure that that telephone button is the one that's clicked so that the sound only comes through the telephone. Second, for all of you who are on the call, there is going to be an opportunity at the end for questions and answers. There are two different ways for you to do that. So everybody can submit questions through the control panel, and you'll see the arrow pointing there down at the bottom where it says questions. You can type in a question, and it basically is sort of a chat mechanism that I will receive, and then I can read your question when we get to the Q&A portion. If you want to be able to speak and to actually ask your question out loud, I believe that you do have to be called in on the telephone as opposed to using your computer. And what you would do is you can see on the sort of the top arrow there is pointing to a little hand. You can raise your hand. You can virtually raise your hand. And if you raise your hand and I see you, then I can unmute you and allow you to ask a question. So when we get to the Q&A portion and you want to ask a question, you can go ahead and do that. In the meantime, for the bulk of the presentation, if you have a question or something that comes up, you can go ahead and use that question panel on the bottom. So I'm going to go ahead and jump into the content for today's web seminar. So you all should have received the new reporting form. I'm going to talk about a little bit of or some overview information, and then we're going to actually walk through the different components of the form itself. First of all, who should use this form? So past grantees. So if you receive money through PASS, through ESG funds, Oakland General Funds money, CDBG funds that come through CHS, you will use this report. Second, if you're an SHP grantee, you will use this report. Second reports still need to be provided for OPRI. So if you are an OPRI provider, you still need to continue to do the OPRI report that you've always done before. And if you receive CDBG directly from the Oakland Department of Housing and Community Development that doesn't have any involvement with CHS, you need to report to them directly for that. But if your CDBG funds come through CHS, then you would be using this form to do your reports. So what do you submit with your monthly reports? So you should submit your reports to all the different contacts you have at CHS who oversee your contracts. So if you have a PASS contract and you also have a separate SHP contract, and the staff person who oversees that contract, it might be different staff people, one for the PASS, a different person for SHP. So you'll have to send the report to both of those different staff contacts. In addition to the spreadsheet that we're going to be going over, you have to include a demographics report and an outcomes report that get generated through HMIS, and I'm going to show you in a minute how that's done. The template contains multiple tabs, and again, I'll show you that in a minute. And so which tab you use is going to be dependent on your funding source. And you have to complete all sheets that apply to the funding source for your program. So I mentioned that in addition to the spreadsheet, you have to submit 2 reports that come out of HMIS, a demographics report and an outcomes report. So you've probably already seen, or you will see when we go through the spreadsheet, that in the past, you had to put a whole bunch of demographic information on that spreadsheet where you had to take it out of HMIS and then retype it into the spreadsheet to submit to CHS. So we've removed all of those demographic variables from the report. And instead, hopefully it'll be a lot easier, you just download the demographics report straight out of HMIS. It'll come out as a PDF file, and you just attach it to the email that you send with your report. So the screens that you see in front of you are the HMIS, the Alameda County in-house screens that you will use to get these reports. They're already programmed into HMIS. So the first one you see is demographics here, and so you just go to this agency and generic reports, scroll down to demographics, and that will print the demographics report. And then the second one on the right here is the outcomes report in the same location, except you select this outcomes report. So once you do that in HMIS, this is what you'll see. These are examples of the actual PDF reports. So the first one is the demographics report, this green one here on the left, and you'll see that it will print out both for the period and for year-to-date numbers, ethnicity, gender information, veterans, numbered ages, all of this different information that's needed. It also provides this economic data down at the bottom, which is specifically something that those who receive funding through CDBG are going to need. There's a couple of other pages here on the demographic report that I want to just show you, although they're not as relevant. So when Patrick over at HMIS created this report, he did include some information there you see in box number 2 around information that he thought might be useful to you in calculating occupancy numbers, and then also the services category piece. Now, we understand that not everybody is entering actual service contacts into HMIS, and so you don't need to worry if these numbers are inaccurate. You don't need to worry about that. However, if you go back up to the first page of the report, you've got these numbers here that show the total unduplicated number of persons and total unduplicated number of families you've served for the period and the year to date. These numbers do need to be accurate. If you're keeping records separate outside of HMIS that are different than these, then you need to figure out what that discrepancy is and correct it in HMIS. So you can't report different numbers on the report from what you report on, from what comes out of HMIS. So let's look at the outcomes report. I'm pausing here because I see that there's a couple of questions coming in, and so I just want to take a look at those. So there's a question about how to get these reports. So again, as I showed previously, they are in HMIS, and there's a question about whether or not there's a specific report just for Oakland, and it's not, but those screens that I showed you before, that's exactly where you will go, and those are the names of the reports that you're going to use to pull those reports. So the one that says demographics and the one that says outcomes. And I can pop them up again here really quickly. Here's the one that shows demographics. And I'll pop up the one that says outcomes. So again, you're going to go into HMIS, and you're going to use these particular menu items to pull these two reports. And if you have questions, you can certainly get in touch with Patrick to make sure you're pulling the right report. So over to the outcomes report over here on the right. This should look pretty familiar. This is the same outcome report that's always been generated in the past. So the data that's going to be most relevant to you is going to, of course, depend on if you're a transitional housing program or a permanent housing program, et cetera. I'm not going to go into a lot of detail on that because that's no different from the outcomes report that's been around for a long time for use with Everyone Home outcomes. So those are your attachments. So now let's get into the actual report itself. So you'll see here on the screen is the spreadsheet. You see at the bottom we've got multiple tabs. Everything that I am going to talk about right now is included in this Instructions tab. So if you click on this Instructions tab, you'll see here that it provides a bunch of instructions about how to use this form. And so if you have questions once you actually start using this, take a look at this instructions and see if that answers your question. Of course, if not, you can ask the question to the program monitor who's with CHS. The first page is a cover sheet. Everybody, no matter what your funding source, is going to complete this cover sheet. So all grantees complete this top part here, lines 1 through 10. If you are receiving funds through CDBG, you also have to complete lines 11 through 29. So this bottom part is only if your funding is all or in part through CDBG. The top part here, everybody has to report. I want to point out a couple of things. So there's some of these lines. So agency, I'm just going to type in here, test agency and the test program. And I'm going to go down to the report period. I'm going to say that the report period is 8/1/14 through 8/31/14. And the reason I'm entering those three fields in particular is because those three fields, if I go to any of the other pages, that information is up here at the top. You see what I typed in there, test agency, test program, and the period are up at the top. So you don't have to retype that information. It automatically populates so that anybody who's looking at the other pages in the report will see the name of your agency and the program and the period for that. Coming back to this page, just to note that the program type is actually a drop-down menu. And so you can see here that there's select options that you have to pick from. If you're a drop-in center, an emergency shelter, or rapid rehousing, and the field is limited to those options. And if you don't select one of those options, if you try to type in something other than one of those options, you will get an error message. So you want to make sure that you pick from that list. So that's the cover sheet, pretty straightforward. I'm going to go over to the Past Services and Objectives tab, and I want to say that the information on the Past tab and the SHP tab are basically identical, and so I'm not going to go through it twice. So if you're an SHP grantee only, continue to listen because everything I say is applicable to you. Even if you're not actually filling out the Past form, you will see that when I get to the SHP one, it's exactly the same. So everybody should continue to listen to this, whether you're Past grantee or not. So what do you do with this page? So the top part here is where you're putting information about who you served in your program. This number, you can see here, the data comes straight out of HMIS. So you just, from that HMIS demographics report that we looked at earlier, you're going to see how many are in the program at the start of the period, how many new, how many exited, the number in the program at the period of end, and the total served. And you're just going to enter those numbers straight out of the HMIS report. And once again, you have to match the HMIS report. You shouldn't be using numbers that are different. The contract goal for the period, so this you're going to enter manually into this field depending on how many people you're obligated to serve based on your contract. And then this field, the percent of goal, will just automatically calculate whether if you served 20 people and your contract goal was 25, then it'll automatically calculate that you've served 80% of your goal for this period. The next section, 1B, this is the occupancy. So this is only for permanent or transitional housing providers. If you're an emergency shelter provider or drop-in center, you don't have to worry about section 1B. But if you're a permanent or transitional housing provider, you're going to indicate the physical number of housing units that are part of your program. So if you have a building with 12 one-bedroom apartments, then this is going to be 12 physical apartment units. And then you're going to calculate your average occupancy. And there are detailed instructions in the instructions tab about how you calculate occupancy. So you're basically looking at the number of nights during the month that each unit was occupied. So if you have 5 units in a 30-day month, then essentially you have 150 days of potential occupancy. 5 units, each one is available to be occupied for 30 days, 150 days of potential occupancy. Let's say 4 of those units were occupied for the entire month, and then 1 of those units was occupied for only 10 days. So you've got your 4 units times 30 days, 120 days of occupancy, and that 5th unit was occupied for 10 days, so that's 120 plus 10 is 130. And so you've had 130 days of occupancy out of 150 days of possible occupancy, and you calculate the percentage, in this case 87%. So that's how you're going to calculate those occupancy numbers. Section 1C is only if you are an emergency shelter provider. So if you're permanent housing or a drop-in center or transitional housing, you don't need to worry about this. But if you are a shelter provider, you need to provide the number of beds, the average occupancy. Again, you're going to do a similar kind of calculation. The number of those beds that are restricted to family-only beds. Again, the occupancy for the family-only beds. The total number of bed nights available and the total number of bed nights provided. And these two numbers, the bed nights provided and the bed nights available, those are the numbers that are going to go into your calculation that determines your occupancy rate. Also over here on the right, you're going to provide the number of meals that you served and indicate what your contract goal is for serving meals. And again, it will auto-calculate a percentage for that. Section 2, scope of services. So this you can see is basically just blank lines. You're going to take I had a question about repeating the numerator and denominator for average occupancy. So before I go on to services objectives, let me go back and give that example again. So the denominator is the number of bed nights available during the period. So if you're an emergency shelter and you have 10 beds in a 30-day month, essentially you have 300 bed nights available in the course of that month. And then you're going to figure out how many nights was each bed occupied, and you're going to add those up. So if 9 out of those 10 beds were occupied every single night, that's 9 beds times 30 days, which would be 270. And then one of those beds was only occupied for half the month, and was vacant the other half, so you've got 15 bed nights occupied. You've got your 9 full-time beds at 270, that one bed that had 15 days, you add those together, it's 285 bed nights of occupancy. And that's going to be the numerator for this calculation. That's the total number of bed nights provided. Divided by total number of bed nights available, 300. Again, you're just going to do the calculation. In this case, it's 95%. So getting to the services objectives, in the first column, you're going to put what the objectives are from your contract, goals and objectives straight out of your scope of services. And then in the second column, you're going to put the accomplishments. So this should be very familiar. This is really the same as how you've been providing this information previously. And you'll see that it says provide numbers to quantify status. So you want to make sure that these are quantifiable accomplishments based on what the scope of services objectives are. There's 10 lines on here, and if your contract has more than 10 objectives that you need to report on, just send me a quick email. But this form is locked, so you can't make changes to the formatting of it other than just filling out the information. But let me know if you need additional lines, and I can very easily expand this and add some more lines and send it back to you for you to use for your program. Corrective action plan, complete this section only if the program is not on track to complete your contract objectives. If that's the case, you want to indicate which areas are not on track, the specific steps that you plan to take to get the program on track, and then the deadline by which you're anticipating you're going to complete those steps. Again, if you end up in this situation and you do need more than 3 lines, let me know and can certainly expand that. Or you can sort of address multiple areas or provide multiple steps within one box. Last section here is the narrative. So again, you've had this box all along, so it's no different from what you've been providing before. You're going to use this section to provide any clarification about your report, any particular accomplishments that you want to highlight during the period, as well as any challenges that you've encountered during the reporting period. I'm going to go over to the SHP tab. You'll see it looks basically the same. The only exception is it's missing the box around emergency shelter outcomes because there are no SHP providers who are emergency shelter providers. Other than that, it's exactly the same as what we just went over for the PASS tab. I'm not going to go over it again. Just know that if you're SHP, you use the one that says SHP. The last tab is specifically for those providers who are receiving all or part of their funding through CDBG. Again, this is where your CDBG funding is coming through CHS, not funding that you have a direct relationship with the Department of Housing and Community Development. This form, for those of you who have had to provide CDBG reporting information in the past, it's the same as what you've always done. There were no changes made to this form. It's just on a different spreadsheet along with the rest of these forms. So it's the same form that you've always had to do for CDBG. So you're going to list what your process and outcome objectives are, what your yearly goals are, the number of new clients from this month, the number of continuing clients for this month, which is going to give you your total for the month, and you're going to fill out what the total is year to date for each one of these different goals. Down at the bottom, you're going to input the total unduplicated number of clients served. So this blue box and this yellow box, this is not adding up the numbers from above. This is numbers that you have to enter in what the total number of unduplicated clients are for this month and for year to date. You also have to provide the number of physically disabled and the number of cognitively, meaning mental or developmental disabilities served. You can pull this information from the demographics report. Just to clarify, I just had a question about when do you use this form. You use this form if all or part of your PASS funding comes from a CDBG grant that is received by Oakland CHS. If you're not sure about whether any of your money comes from CDBG, you should contact your contract manager and ask them whether any of your funding comes from CDBG and whether or not you have to do this form. Because past programs often have a mix of different funding sources, ESG, CDBG, general fund, and so you want to make sure to check with your contract manager to see exactly how your program is being funded so that you make sure that you're submitting the correct forms. For those who receive CDBG funding, there are specific requirements about doing client satisfaction surveys, and so you'll provide that information here on the form about the number sent and the number received. And then again, there's space to do any sort of narrative you want, and if you have a corrective action plan, because you're not meeting any of your objectives, they'll provide that information there. So that pretty much covers the report. If you have questions, I did sort of try to answer the questions that were coming in as they were coming in, but if there are additional questions you want to ask, feel free to either send them in through the chat or raise your hand. Dolores Ellis, you look like you have your hand raised. I'm not sure if that was a mistake. It doesn't look like you're on the telephone. So if you have a question, go ahead and send it on the chat, because I don't think I can unmute you. So there's a question, currently the template does not fit on 8.5 or 11 in portrait format. Do you want us to print it on 8.5 by 11? So yes. And it is supposed to print 8.5 by 11, and so it sounds like there's some sort of glitch in the formatting. And so I will play with that a little bit and send out a revised version, because the intention is that this is supposed to fit on an 8.5 by 11 sheet of paper. So let me kind of investigate that and figure out where the glitch is, and we can resend this template out so that it works properly. Although for the most part, this is going to be sent by email, probably not by hard copy, but it definitely is supposed to be printing that way. So I will fix that. So I've had a request to go over the occupancy numbers again. I know it's confusing, so bear with me. For those of you who don't have to do this, I'm going to go ahead and go over it again, just to make sure that everybody's understanding, because it is a little bit confusing. So you have two numbers that you need to calculate in order to figure this out. You've got your numerator of your fraction, basically, and your denominator. Numerator is what goes on top, and the denominator is what goes on the bottom. So the number that goes on the bottom is the simplest one to calculate. If you're a permanent or transitional housing provider, you're going to take the number of units and multiply it by the number of days in the month. So to make the example easy, we're going to say that you have 10 units. If you're an emergency shelter provider, you're doing the same exact thing, except you're looking at the number of beds in your shelter. So you have a shelter that has 10 beds, and you're in a 30-day month. So the total number of available bed nights is the total number of beds or units, 10, times the total number of days, 30. If it's a 31-day month, it's going to be 10 times 31. So we're going to use 30 because the math is easier. So we have 10 units, 30 days in a month. That means there's 300 possible days that a bed could be occupied. So it's 300 bed nights is what we call it. That is what goes on the bottom of your equation. What goes on the top of the equation is how many, the sum total of how many nights each one of those beds was occupied. So if you were at full occupancy the whole time, every one of your 10 beds had somebody sleeping in it every night, you're at 100%. Your total number of occupied bed nights is also going to be 300. However, you might have had some nights where one of those beds or more than one of those beds was empty. And so for each bed, you've got 10 beds, you need to look at how many nights was this bed occupied during the month. So you look at bed number 1 and you say somebody was in that bed every night. So that was occupied for 30 nights during the month. Bed number 2 was also occupied for 30 nights. Bed number 3, let's say there were 5 nights during the month that it was vacant. Nobody was in there. So that bed was only occupied for 25 days. And you continue to do that for each one of your 10 beds, and you add up all of those numbers. So you've got 30 for bed 1, 30 for bed 2, 25 for bed 3, maybe bed 4 also was vacant for 5 nights, and so that's 25. And when you add up the numbers for all 10 of your beds, you see that of the 300 possible bed nights, you had 290, because 2 of those beds were vacant for 5 nights out of that month. So your total is 290. That's what goes on the top of your equation. So you've got 290 on the top of your equation, 300 on the bottom of your equation, and then you do the division. So 290 divided by 300. And that's going to give you some percentage, in this case, 97%. So I hope that that clarifies. Any other questions that folks have? You can raise your hand or type them in. Susan, did you, well, let's see, we've got a few more questions here. Is there a separate report for client demographics? So that is the report that I referenced at the beginning that you pull from HMIS. So you're no longer having to type in client demographic information into a spreadsheet. All you need to do is pull the demographic report straight out of HMIS as a PDF and attach it to what you submit. So that's how you get to your demographic report. There's a question, if we need more lines for the scope of services portion, what's my email address? Good question. I'm going to spell it out for you. It's Deb, D-E-B, and my last name is R-A-U-C-H-E-R at sbcglobal.net. If you didn't catch that, just email your contact at the City of Oakland, and they can provide you with that information, or they can make a request directly to me, and I can add those lines. Another question here. In the past, we needed to submit each month of the fiscal year up to the current month of reporting. With this new format, we only submit one sheet for the month and year to date. Do we need to submit multiple HMIS reports to capture the monthly count and year to date? So I believe what you're referring to is that the way that the previous past report was structured, you had different tabs for January, February, March, April, May, June, and you sort of submitted the whole thing every time, and it automatically kind of added one month to the last month. So this report obviously is not structured that way, but you only need to submit the report for each period, because you will have submitted the previous period during the previous month. So you don't have to worry about that. You know, we actually realized that that was not providing accurate information, because just doing that calculation of adding up January plus February plus March plus April didn't actually give you an accurate number of the total year to date, because some clients were served in both January and February, et cetera. And in terms of the HMIS reports for monthly count and year to date, those reports, let me pull them back up. You'll see that it's a single report, shows the reporting period. So you're going to enter in, you know, this report period is August 1st to August 31st, 2014, or whatever it is. It's going to do the reporting period and the year to date. It's all included in a single report, so you don't have to worry for HMIS with generating different reports. It's all there in one. I have a question here. Susan, I'm going to direct this one to you. It's about, for emergency shelters, somebody wants to know how they count the number of meals served. So I don't know if there's any additional clarification you can provide on how meals get counted.
Count the number of meals. I wonder why they're counting. I assume we're paying for food. And how do they count meals? You should, can they hear me, or are you typing this in?
Yes, they can hear you.
Okay. That whoever this is, you should give me a call. I want to talk to Mike about it. I mean, we run a food program, and we have a particular formula that we use to calculate meals per bag, and I guess we could translate that to that, but I'd like to know who it is, and I'd like to know why you're counting meals.
So this is something, I'll just say that this is on the PATH report where it's being, emergency shelter providers are being asked to report meals served. This is not a new reporting requirement for this report. This is something that was on the old PATH report. So it should just be, you know, however you were reporting this information before, it would be the same. But if that doesn't answer the question, then definitely reach out.
And if anybody else is reporting meal served, I don't know why you couldn't just do a meal served. You buy food, you count the number. If this is a shelter, you get to count the number of meals you serve.
Yeah. So the person who asked that question, if your question has not been answered, reach out to Susan, and she can talk with Mike, and you can figure that out.
Thanks.
I'm going to give another minute in case there's any other questions. All right, I'm not seeing any other questions. Of course, if you have questions, you can email your contact at Oakland. Susan, any last words you wanted to share before we sign off?
Well, I hope this was helpful. I'm going to assume by the few number of questions that people didn't think it was all that different from the data either you're reporting somewhere else or have been reporting for us. And I would agree with Debbie, if you have any questions, please get them to us ASAP. We intend that you start using this form for your new contract with us. So really wanted to make sure you all were on this, that we had this training provided as soon as we could. And given there are no more questions, I suppose everyone is up to speed and ready to produce. So thanks so much for being on. Thanks, Debbie.
I wanted to just let people know that we did pilot this with a couple of providers. And so there's a couple of providers out there that have already been using this for a couple of months, and it seems to be going well. So hopefully it'll go well for the rest of you as well. And I also want to say thank you to those who did pilot it. One last question. Are we supposed to use this with the billing that's due tomorrow? Susan, you still on?
I would think so. If that is problematic, you should let us know. You should let us know.
Okay. All right. I think that's it. So thank you all for being on the webinar.
Thanks again.
Bye.
Bye-bye.